Hey, good morning, everybody. This is Jamie Litrun with ADR Spine Surgery and Support Group on Facebook and spinecircle.com. If you're just seeing this video for the first time on one of my videos, remember to hit subscribe. It would be really great to kind of get some subscribers going. But I'm here with the great Dr. Alexander Rasouli. And the reason why we're having this brief conversation today is to talk about some of the things that's coming up in his practice in Beverly Hills. We finally got to meet for the first time about 2 weeks ago. And I was kind of able to, divulge with some of the things he's got going, but I wanted to kind of hand it over to you, Dr. Rasouli. You've got a new state-of-the-art surgery center opening as well as an office. So you're kind of having a big move here coming in a couple of weeks. I'm sure that's going to be a little bit rough, but probably the end result is going to be amazing. But I said, let me hand this over to you. Tell me what's going on.
Thank you so much, Jamie. It's really nice to see you again. And I hope all your subscribers are doing well and your viewers are doing well. We're excited because the vision that we had several years ago is finally coming to fruition. And that is the opening of a one-stop shop sort of endeavor. And that's our own Spine Institute in Beverly Hills. We hope to expand to other regions as well. This vision is really built around not having to go to the hospital to have your spine surgery done. And as I've mentioned to you before, our techniques have become so minimally invasive with such little blood loss and really no need to stay in the hospital after the surgery because of anesthesia and how good they've become. And quite frankly, how good medical devices have become where you really don't need to go to the hospital. And the hospital these days is not a good experience. It's restricted thanks to the pandemic. It's impersonal, it's busy, it's messy. You may not have a private room. In any case, if you can get away with doing surgeries in an environment that's private and you get to go home that day, then I think that's the next sort of generation of spine surgery. It's the next step. And I think we've been able to master that pretty well. And to have the office setting and the surgery center in one location, I think is really advantageous to patients. And if that center also has the latest and greatest in equipment, including the EOS minimal radiation X-ray system, a multi-million-dollar robotic surgery platform so that our incisions can become even smaller, the latest and brightest personnel in terms of nurses and anesthesiologists and access surgeons, then you suddenly have a value added for patients. And so we're really excited. The flagship is going to be in Beverly Hills. We have centers potentially opening up in the Central Valley, in Orange County, in San Diego. And I hope this can be a model for other surgeons to be able to offer patients something that really doesn't involve the hospital at all, quite frankly.
That's exactly spot on. And I guess I wanted to talk to you about your new surgery center compared to your one of the things, and you just did a case recently with one of the group members. It was a 3 or 4 level cervical, and one of the things I noticed is the displacement was perfect. How do you there's different ways of getting that perfect placement, obviously by imaging. Do you use an O-arm? Do you use just a regular static X-ray after what? How do you get that perfect placement every time?
Unfortunately, perfect placement comes with experience right now. So it comes with mastery of skill set. We use plain X-ray, but the whole point of having institutes like the one we're starting is to be able to give more patients access to this kind of surgery, and that's kind of going to come with computer-assisted surgery. So slowly you remove the variations in surgeon skill set out of the equation, and you let the robot kind of guide you in terms of placement. And for better or for worse, Machines usually don't make mistakes unless they're programmed to. But that's the future of the new surgery center is going to be reliance on at least assistance from a robotic platform. But if I'm doing your surgery, it's probably based on sort of the skill sets that you acquire after many years of experience.
And one of the things you mentioned too was the EOS, and everybody in the group is very familiar with EOS. We talk about it. We think it's, it surprises me, especially being in the United States, that probably 10% of spine surgeons use EOS. We know it's been used in pediatric, deformity for a long time, which
Right.
completely where it grained, where it got its footsteps in France and then kind of evolved. And then, wise surgeons like you says, listen, it's not just about that small area. It's about the way the whole sagittal balance looks under things. So that's fantastic to hear, because we definitely always push that, as well as a lot of other things to be done before and after. And I think that just gives everybody a sound mind. One of the last things that I know the group members love to talk about is disc. And I know you did the Axiomed trials back in 2010. And obviously we, as I mentioned to you before, we have a few members from that trial of yours that are in the group that are doing fantastic. But maybe tell me what your thoughts are on that disc completely, and maybe anything else that is a highlight that you see coming in the future.
Yeah, I'll mention the EOS system real briefly. The EOS system is an example of something that was initially intended for one purpose, but the innovation is to repurpose it. So the EOS, for patients that don't know, is a really, really low radiation X-ray system. You step into it, it takes an X-ray, but it takes an X-ray of all of you.
Right.
Often with less radiation than if you were to just take an X-ray of one region of your body, and that's really important, number one. The second important point is we're learning more and more. If you operate on one part of the spine without knowing how that part aligns with the rest of the spine, you might be doing the patient a disservice, because you might be disturbing some alignment or some balance that the patient's body has struck over years. And you won't know that if you, for example, the patient comes in with neck pain and you just take an X-ray of the neck. Well, how do you know that that patient's neck isn't the way it should be based on the rest of the way their body is? And you'd not know that if you don't have access to this kind of technology. So we've repurposed it, not just for the pediatric scoliosis population, but for the general population, because we're really interested in global alignment and knowing how the patient's spine is supposed to be, how that particular patient's spine is supposed to be in all its regions before we operate. So that we're really excited, and we're one of the few private offices in the entire country, if not the world, that has that technology available in the new institute. You asked about the Axiomed, and so artificial disc replacements are a big deal. And the reason they're a big deal is because they allow us to fix problems in the spine without resorting to some of the cruder technology that's out there, which is fusion. Fusion means you take a couple bones in the patient's spine and you put screws across it and you kind of bind it together with rods. For some people, fusions are absolutely necessary and a godsend, fixes them. For most people, though, you can probably get away without fusing parts of the spine together because it's not natural. You want the spine to be able to move. And because most of the problems in the spine are due to failing discs, why not address the main problem, which is the disc, hence disc replacement. And disc replacements allow patients to have a more natural surgery. They allow better results, quite frankly. They allow patients to get back to work really quickly, days or weeks instead of months or years. And they really cut down on the times patients have to come back for reoperation to essentially close to zero. If you get with your more savvy patients, or unfortunately patients who have experienced this, you get a fusion, you might be back for more fusions. But with disc replacement, patients hardly have to come back. Now, if you're going to do a disc replacement, you want that disc to be a replacement, not merely an approximation of a real disc. But the disc replacements up to now are a lot of moving parts. They're metal parts to plastic parts, and they move against each other, and that may not be the most natural solution. The newer generation of disc replacements, there are no moving parts because your natural disc has no moving parts. It's basically a material that's spongy and jelly-like that moves in an infinite number of ways. So if you're going to have a disc replacement, you want something like that. And that really relies on innovations in material science. And so some companies are getting that, and you're going to be seeing on the market more and more discs that act as real kind of discs, meaning no mechanical parts. They move, and they move in an infinite number of ways, just like your own discs, but it's not kind of a ball and socket joint that we put in like the hip. Axiomed was one of these. The FDA trials, which take a long time and are very expensive, started many years ago, were finally completed, and you're going to see FDA approval soon, if not imminently. And so we're going to be able to put those in the lumbar spine, and I think patients would benefit from those. We already went through the learning curve and all the experiments and the studies, and so we can put those in with confidence.
Let me ask you this. Do you happen to know why it didn't make it to market back when you did it in 2010?
Yes, I know exactly why. So in 2010, we were just reeling from the economic collapse, for a while, and this has to do with as much politics as it does with the economics of healthcare. The old guard, so to speak, that is to say the generation of surgeons that preceded mine, didn't believe that spine surgery should be a quality of life surgery. Spine surgery should be, you're essentially crawling into the doctor's office. You haven't been able to work. You haven't been able to do sports, forget about sports or leisure or anything like that. And so you should undergo a fusion because it's a last ditch effort so that you don't have to take as much narcotics. That's essentially was the goal. That's really outdated thinking. The goal nowadays for our very active population is, I hurt, I can't run, I can't jump, I can't be active in sports, I can't bike, I can't pick up my kid. And so I want to be rid of the pain. So it's no longer a surgery of, I'm crawling out of bed. It's a surgery of quality of life. And the old guard didn't believe in that. And that's why disc replacements in general didn't get much traction. But they are now because of newer, younger surgeons coming up through the ranks and patients who are more savvy and demand quality of life surgery, not life and limb surgery. So that's why technologies like Axiomed were first limited by some financial issues, unfortunately. But now that those have been resolved, then had to deal with the political issues. And now that the generation before ours is largely irrelevant and retired, the new way of thinking can come to fore, and you can do technology like this.
That's spot on from what I know as well. So for patients that are international, and then obviously in the United States, you get quite a few from Canada. I mean, obviously we have a large group from Canada. Tell me about the protocol for them to see Dr. Rasouli, and then, what are the steps that they need to get to you? And then if surgery is consulted, that you both agree that this is the right decision, how's that all taking place? That way people can kind of understand, hey, what do I need to do? Where am I going to stay? What is set for me?
We make it really easy. We've invested a lot into our digital presence, our website presence, and all of our contact information is there. But the office in general, the office particular, and the practice in general is very concierge oriented. So we have numerous liaisons in the office that hold the patient's hand from that first call to recovery. My evaluation of the patient can be done virtually or in person. The virtual medicine was a thing before the pandemic, but we really perfected it during the pandemic. and that's because the MRIs and the CT scans are so good these days. You know, they're crystal clear. You really can tell everything you need to from those studies. If the patient, and I agree that surgery is probably the best option. It's never the only option, but it's sometimes the best option. And if we come to that agreement, then the patient's scheduled for surgery by our team. And then they come to Beverly Hills either the night before or the day of, and the surgery is performed, again, outpatient. They can go home that day or the following day, and then subsequent follow-ups are again done either remotely for our international or out-of-state patients or faraway patients or in person. There are always many, many tiers of support staff, from our liaison staff to PAs to nurses to me. It's a very sort of tight-knit concierge type approach to spine surgery. It's spine surgery, so you don't want a typical doctor's office where there are barriers to entry.
Sure, sure. Well, that sounds very easy and simple, which, you know, everybody's looking for. And obviously with such a big surgery, people want to feel satisfied in what they're going to do. So I think, and I know that just from all the patients, and I think the group really knows from all the patients that's come through, that everything has been handled fantastically, and you give the injections to make sure that they don't clot on the plane, and so many of the things that we've seen happen with other patients.
Right.
So that's all I have. I'm not sure if there's, you know, there's one thing more I did want to ask. So your surgery center in your office, when do you think that's going to open?
Yeah, we're opening in phases. The first phase is the practice headquarters, which is the administrative offices and the consultation aspect of the practice, and that's going to open either next week or the following week. The surgery center itself will be launching within the next 6 to 8 weeks. The surgery center we are at now is a fantastic surgery center, and it's amazing people. And so we hopefully, you know, partner with them and can replicate what we have now. And I think it's going to be a great thing. I think it's going to help be another step in redefining the way spine surgery is done in this country. We want the United States and Beverly Hills in particular to be the destination where people come. Before, you know, it was in vogue to go to Germany or France. And while I admire my European colleagues, I think we can do better. And I don't think that Americans should leave America to have the latest and greatest.
No, I agree. I think it's all, you know, it all depends on insurance, right? That's the big, you know, getting everything approved here, and we know that can be a little bit difficult at times. And and I think that's why some people do go across, because, you know, with insurance, if they get denied. But I know your team really works hard on getting things approved. And
we work hard, and if insurance doesn't approve it, then we work even harder to get our manufacturers and device reps, because we do so many cases and have a lot of clout. We can often get devices donated, or we can work with patients on cost. We're not really about the money, so to speak. We're about getting perfect results. And so insurance may have been an issue in the past, but it's less and less an issue as we're bypassing that.
So you're getting 2 levels approved for the most part?
Yes. Thankfully, there is FDA approval and therefore foundation for those 2 levels on both the lumbar and the cervical. So if an insurance company is denying that, they're really not looking at data and behind the times.
For sure. And we show the data constantly in the group. Listen, this has been fantastic. I think our group members are going to love what they hear. I think they're going to love what you're doing. And I really appreciate you taking this Sunday morning to have a little time with me.
It's my pleasure, James. It's always nice to see you, and hope you have a great and healthy summer. And we're here for it.
Right? It's here. I'm sure I'll see you again here. Lastly, if there's any patient, and I know I talked with one of your administration people, Cole, about having a patient, be filmed from start to finish. That way, patients that are looking to see how everything is done to get those nerves settled. So if there's a patient that wants to be, shown and have a video and shown in the group, we'd be really excited to have you do that. So reach out to me, Dr. Rasouli, reach out to Dr. Rasouli's office. I mean, that would be the right way to go, and let them know that you definitely have interest. That way we can give more and more great information and to everybody. Thank you so much, Dr. Rasouli.
My pleasure, Jane. My pleasure. Have a beautiful day.
You too.
Bye-bye.